Let's break down prescription drug coverage. Almost all of our Generations Advantage plans include Part D prescription drug coverage, except the Alliance Plan, which is designed for people who already have this coverage through TRICARE, the VA, or an employer plan. There are two key parts: drug tiers and coverage phases. Drug tiers are 5 or 6 categories that vary by type and cost. Coverage phases are stages that members may progress through during the year, based on their out-of-pocket cost on prescription drugs. There are 3 phases. First is a deductible phase. Only some plans require this. In this phase, members pay a deductible for certain drugs before coverage begins. Next, all plans require an initial coverage phase, where the plan and members share drug costs. Finally, there's the catastrophic coverage phase. After members reach a yearly out-of-pocket limit, they will pay nothing for covered drugs for the rest of the year. Coverage resets on January 1st, starting over with the deductible or initial coverage phase. So, how do you use this benefit? First, review your plan's formulary, where you can find a list of covered drugs, tiers, and cost information. Next, have your provider send your prescription to a network pharmacy. Choose a pharmacy with preferred cost sharing, including Hannaford, CVS, and some local pharmacies, to pay no or lower cost shares on many drugs. Make sure to present your Generations Advantage member ID card when picking up your prescription. You may also use the CVS Caremark mail order pharmacy for many prescriptions. If you're interested in learning more, visit martinspoint.org/Part D and learn how to review your plan's formulary, find a network pharmacy, sign up for mail order prescription delivery, and learn about the Medicare Prescription Payment Plan, a program that spreads your out-of-pocket medication cost over the year in monthly payments, rather than all at once at the pharmacy. Questions? We'd love to help. Call Member Services at 1-866-544-7504 or visit martinspoint.org/Part D. We're happy you're here.